when we started off in aesthetic medicine, we didn't push on our patients. I think patients don't like to be told what to do, or they also take offence when you might raise things like, I think you could do something with injectables, or your skin's not looking good. You've got to offer some subtle approaches. So when I started out, I used to have my nurses who took photographs would often raise the question that there are other things we can offer here. Are you interested in them, rather than it coming directly from the doctor? Because I think they do sometimes feel like they've been put into a corner and sort of upsold. We also had quite a few banners around the surgery when we started to use aesthetic treatments, just making people aware that these things were being offered. Obviously these days you've got to be very careful in your advertising approach. The new guidelines have insisted that we can't use any of those terms in our social media or on our websites even. So whatever we do now has to be very much patient-driven, not doctor-driven. So we are becoming more conscious of that. The best things you can do in terms of getting your staff on board are obviously to offer treatments when you're training. It's good to get your confidence and skill up by offering treatments on a night basis to your staff, your loyal staff members. They will see the benefits of the treatments, and then they will recruit patients themselves. So I think that's a good starting point, friends and family first, before you operate on real patients. Best thing to start out with is having a range of cosmeceuticals and sunscreens that you offer as point of sale as soon as the patient walks out the door. Once a patient has had a skin repair consult, they're very keen to get onto something. Having seen that damage under the woods light, they want to start something straight away, and having them able to get some vitamin C serum, some sunscreen and perhaps a derma roller as soon as they've left your consult room is a good start. I get them used to that concept of skin health first before I mention booking another appointment for injectables. And most patients are very happy to book for botulinum toxin injections very soon, because it's a quick and easy option and minimal risk involved. So when you're starting out, you want to get your confidence up and feel like you know what you're doing with injectables in the face. So botulinum toxin is always a good thing to book them in for 2 or 3 weeks after they've started their skin repair routine at home. And later on, when you've got more confidence, the more advanced things that may require more skill and perhaps greater risks, such as the injectable fillers, platelet-rich plasma, laser treatments, are probably things you'd offer once you've got the confidence of the patient. At Newtown, in my centre, we've never had to advertise. Most of our patient base has come from within our practice. We get a few people who come in from outside who are not members of the skin cancer check community. It's all been word of mouth, and I think in a place like Hobart it was very easy to do that, but I understand it can be quite challenging for people in bigger cities perhaps, where they're competing with more nurse injectors and beauty clinics and everything like that. But I think the most important message is to be true to yourself, and the patient, word of mouth spreads. I think even in a big centre you'll get the right type of patients doing it that way, rather than to go out and sort of seek a lot of social media influences and things like that. I think as a primary care skin cancer doctor, you want the right type of patients. Don't be afraid of sort of sitting back and just the patients will come to you from within your own patient base.